It's time for a house call. I'm your host, Kim Beckett. Well, today on House Call, we are going to discuss spider veins, how we get them, and how we can get rid of them. We are so fortunate to have with us today MItch Johnson. How are you?
Good, thank you, Kim.
I'm so happy that you've joined me on House Call today.
Happy to be here.
Let me just give our viewers a little information. MItch Johnson is a physician assistant, and he works at Vein Therapies with Dr. Clark Beckett, a vascular surgeon. And I understand that you gentlemen have been eliminating spider and varicose veins since 2004. Is that right?
The Spider-Man.
I love it. That's great. Well, let me just get started. And can you tell us, how do we get spider veins?
Sure.
And how can we get rid of them?
Sure. I'd like to just start off first by explaining the difference between veins and arteries. Veins are a very thin wall structure. They require a multitude of valves to send the blood forward to the heart and lungs. The blood, when it's oxygenated, is then sent over to the heart. The heart pumps it out through the arterial system. The arteries are much thicker and can withstand your blood pressure. So with the veins being a very thin wall structure, they rely on valves as well as muscle contraction to send the blood forward. It's the valves that's the primary focus of what goes wrong that leads to venous conditions.
Okay. Venous
conditions such as varicose veins and spider veins, primarily. Varicose veins are more of an elevated, larger vein above the skin surface.
Those great big ropey looking veins.
Big ropey looking veins, correct. And that's another whole topic of discussion. Spider veins are more flat with the surface. They come in many sizes and configurations, many colors, blue, purple, red, pink. So spider veins basically are flat with the surface and are primarily a cosmetic concern for the patient, and they pose no health risk whatsoever.
And treating them doesn't pose a health risk either.
Treating them does not pose a health risk, and we'll get into that more later. Some of the reasons why you might develop spider veins are due to the failed valves, or reflux we call it, when the valves fail in the venous system. And what can contribute to that is primarily genetic predisposition. Other factors would be a profession standing for long periods of time in one spot, like a sclerotherapist.
Yes.
Others may be pregnancy, hormones, primarily estrogen, and excessive abdominal girth also just increases venous pressure and causes valves to fail. So eradicating them is our goal.
Absolutely.
Yep. Now the way we treat spider veins at Vero Vein Therapies is a method called Tesari. It's developed in Europe many years ago, in the 50s, and it's a method we find most effective for eradicating the spiders. Now, sclerotherapy is essentially a process of using a sclerosant, a solution, that is injected into a vein to disrupt the lining of the vein and close the vein down. These are abnormal veins. You don't need them. They just are a nuisance to you. And by closing the vein down, it then eventually over time will atrophy or shrink, and then your body absorbs them over time and they fade away in color. It definitely takes some time and a process.
Right.
But that's the whole idea of sclerotherapy, is to shut the vein down and stop the blood flow. Your blood flow is then diverted into the normal venous system. So with the Tesari method, it's an advanced form of sclerotherapy in that you're not just treating the spider vein that you see on the outside, but you're treating and closing down the feeder or reticular veins that are causing pressure and keeping these spider complexes in play. So by closing down and taking off the pressure off the spider complex, it helps to eradicate these in a much better fashion. And in doing so, once again, it's a matter of time for your body to absorb the complex, and repeat treatments take place down the road. But again, it's a very safe method. The solution in our situation that we use is a mild detergent, FDA approved, And we foam it also with a little bit of air.
Oh, interesting.
So that it will disperse evenly within the inside of the vein wall to allow good solution contact with the vein wall to shut it down, and ultimately then for it to disappear once again.
And do you have to use that method on everybody, or do you find that you use different methods for different patients?
The majority of patients have reticular veins that
Okay.
require foam sclerotherapy, and the majority of patients, when they present, they have at least a few. Many people have numerous reticular veins that you have to close down and take the pressure off, and then treat the spider vein as well. So it's a situation that injection therapy is really the best form of
Right.
treatment of sclerotherapy.
Right.
There is also a vein wave, which is another form of sclerotherapy, but not injection. And vein wave is becoming promising. In fact, it was developed in Europe about 12 years ago.
Oh, interesting.
And just the FDA approved here about 18 months ago. And it's specifically more for the tiny fine veins that are difficult to inject. They don't communicate with other clusters, and they're just a nuisance. They are scattered about. So vein wave is a radio frequency similar to microwave heat. So it thermocoagulates the tiny vein right then and there as you're running the probe along the vein.
Oh, wow. And then the vein is gone.
The vein is gone immediately, and it will still take time to fade because that vein has been thrombosed, just
Right.
like with sclerotherapy, injection sclerotherapy. But it will take time to fade away, just like with the injections.
And I understand, too, that Vein Therapies is the only office on the Treasure Coast that has the vein wave.
That's correct, yeah.
I think that that's very cool.
We've enjoyed using it and enjoyed seeing the results of it. But again, the important thing to remember is that it is really more of a touch-up at the end,
Right.
where these veins that are obstinate and persistent need to be treated. The nice thing about vein wave is, unlike injection sclerotherapy, is you do not need to curtail any physical activity or wear compression stockings after vein wave is completed. With injection sclerotherapy, compression stockings are needed for about 5 to 7 days, and exercise is curtailed for about a week, such as impact sports,
Yes.
like running, repetitive sit-ups, any kind of heavy weightlifting,
Right.
elliptical, that kind of thing is fine, but no pounding of the feet, and walking we encourage. So stockings are good for that purpose, but vein wave, when it can be used, you don't have to worry about
Right.
those requirements.
So, and I know that we do have some photographs, too, that they were going to show
we
as
can
well.
Okay. This is a photograph of actually injecting a reticular vein.
That is a
And
very cool looking photograph.
It's a lot of fun, actually.
And it looks like there's a special light that you're using.
It's a fiber optic light that we've been using since the beginning of doing sclerotherapy, and I live by it because without that light to identify the reticular vein, it would be very
And the
impossible.
reticular vein is the one that is underneath the surface that you really need
Sure.
to, it's like the trunk of the tree, is my understanding.
Sure.
Is that right?
Yeah. I mean, you can take all the branches off a tree, but if you don't
Right.
get rid of the roots, it'll still continue
Right.
to grow.
And then,
So
here we have another one, a before and after. It looks like this must be a sclerotherapy patient. Is that correct?
that's correct, yeah. That would be probably after 4 months total of treatment.
Okay.
From,
And how often? Coming every month, is that right?
Coming every 2 months.
Every 2 months. Okay, so that was 2 sessions then. And
That's
then
correct.
here's another patient.
Same thing, yep. The important thing to remember on the patient's part is that,
Oh, and
well, I can skip to this. This is the vein wave being used. And again, it's a little magnifying glass that I'm using, and it's a very tiny probe. You're just moving along the vein in that fashion. The important thing to remember on a patient's part is that sclerotherapy, the end result, everyone's impatient to have the veins free of your legs, but it really takes time to have the fading take place, and you have to have patience. You can't look at this every day. It's a slow process. Everybody's metabolism is different as
Right.
to the speed that they're going to absorb
Right.
these veins that have been shut down.
And so now tell me, what do we have to do if, for our viewers out there that are thinking, oh my gosh, I want to wear my shorts, but I feel like my legs look terrible, and now I want to get rid of my spider veins. What do they need to do?
Well, they can call and we'd be happy to talk to them, and it's a free consultation to just take a look, and we will show and identify the reticulars that they most likely have that we would treat first. Very often I give lunch and learn sessions at Vein Therapies and demonstrate so they can get a better idea.
So they can come in right then and see you actually work on somebody.
Sure.
And use
Yep.
all of these advanced methods of
Yep.
sclerotherapy treatment.
Yep.
And
Anytime.
vein therapy treatment.
Yes.
That's wonderful. And all they have to do is call the office, and I understand the number is 567-6602.
That's correct.
Okay.
Yep. All right.
Well, thank you very much, Mitch.
Sure.
It was so
A
great
pleasure.
having you here on
Yep.
House Call, and I hope you have
Thanks.
enjoyed this great segment of House Call.